Now we're just going to briefly talk about adverse reactions. One of the big ones that you need to watch for that has become a bigger risk and more common is that of the QT interval drugs. There are more than 100 of those that are known. What is the QT interval? The measure of time required for the ventricles to repolarize after each contraction. So QT drugs that prolong this are the drugs that prolong this interval on an ECG. It creates a serious risk of life-threatening dysrhythmias, the torsade du point, and the ventricular fibrillation. So how do you minimize the risk? Most patients are at higher risk, including women, older adults, patients with bradycardia, CHF, congenital QT prolongation, if they have low potassium levels and low magnesium levels. And you should not use two QT drugs concurrently. And since most of the prescribing now is electronic, those systems will catch those interactions for you. When you look up your drugs, it will talk about um, those drug to drug interactions and if the drug could cause a prolonged QT. So you should really be aware that this is something that you should do when you start prescribing medications for your patients, to make sure you look up those interactions and those adverse reactions to your drugs. Black box warnings. Um, those are the strongest safety warnings that drugs can carry and still remain on the market. The purpose of these is to alert prescribers to potentially severe side effects, which are life threatening, such as the dysrhythmias, suicidality, major fetal harm, and ways to prevent or reduce this harm. So you need to be aware of those black box warnings and to heed those black box warnings as much as possible. There's always a risk benefit when you are prescribing, but that needs to be well documented. There's a black box warning with the um, antidepressants for the 16 to 24-year-old range. Well, do we prescribe antipsychotics? Yeah, I'm sorry. Do we prescribe the antidepressants? Yes, we do. Because even though there is a black box warning, there has not been a documentation of someone who has actually committed suicide. What they found is that their thoughts have increased, and that is what prompted the warning. So I just talked to parents about and the child about this warning, and that if they start to have increased thoughts or different thoughts, that they are to let a parent or myself know immediately. But we still do prescribe those, and that's one way that you reduce the harm by providing that knowledge to the patient. Um, Lastly, we're talking about what we call RIMS, which is the risk evaluation and mitigation strategies. And that's a plan to minimize drug induced harm. For example, the RIMS for Accutane is called the I pledge. Because Accutane can cause serious birth defects, um, the I pledge is designed to ensure that those who are pregnant or who may become pregnant will not have access to the drug. So, when a patient goes on Accutane, they have to have a pregnancy test before, and they have to have a pregnancy test on a regular basis, usually monthly. And so that if the pregnancy test is positive, or if the patient um, is not, it must also be on a birth control method, so that we can ensure that the patient won't get pregnant and that the patient is not pregnant or has not become pregnant while on the medication. There are other medications that also have uh, ramifications. They've recently made Suboxone a REM medication because they want to make sure that um, you inform the patient of the dangers of continuing to use their opioid while being on Suboxone for the potential overdose risk. because Suboxone is a partial agonist, there is that potential that there could be some overdose risk and fatality. So now we're done with the slides. We have a couple of questions. So a patient is taking 2 prescriptions, both which cause bradycardia. The nurse should monitor the patient for which type of effect? And the answer, of course, is B, an increased adverse effect. You will not be looking at an increased, while you might be, um, the meds might be given for the same condition, you do have to monitor for that increased adverse effect from the medication. Um, if you want to think of another example for that, um, think of medications to cause sedation, and that's a very serious consideration with the geriatric population. So if they're on a med for that is 2 meds that are sedating, we have to really monitor that patient or try to avoid that because they could have a fall, which can be very serious or detrimental to the patient. Next question, which individuals is at highest risk for the drug-to-drug interaction? And the answer would be C, the adult who takes 8 prescription medications for a chronic condition. The more medications, the more possibility of drug-to-drug interactions or an adverse reaction. The toddler on 2 antibiotics for a serious infection um, will, you would always watch any patient on medications, but the chances that those 2 medications, as long as there's not an allergic potential, should be fine. Um, the adolescent taking an OTC for cramps is only taking 1, and the only older adult who's only taking 2 medications and a supplement, as long as you know what that supplement is, should be fine also. The patient who is taking a calcium channel blocker for hypertension, the nurse should be most concerned with which statement. Okay. And here, of course, the answer is C. We know that grapefruit juice can be a big substance that can interact with your medication. So, and it can increase the blood levels uh, for that calcium channel blocker. So that would be the correct answer here. Next question, prescribed a medication on an empty stomach. Which one indicates, which statement indicates the patient needs more teaching? And that would be A. Because if they take it 1 hour before a meal, they will have food on the stomach potentially before the medication is completely absorbed, so they may miss some of the absorption. So they'd want to take it with a glass of water would be fine before going to bed because they won't be eating anymore, or after the meal uh, would be better than before the meal. After the meal, 1 hour could still be a problem if the patient has delayed gastric emptying, so that would be a specific condition that you would take in consideration there. And the last question, they're prescribed something that is potentially hepatotoxic. Uh, what would be important to assess with this patient? And the answer here would be B, of course. You'd want to check liver enzymes to see that the patient liver's enzymes are normal. If they're elevated, then that may be an indication to switch medications or at least to monitor those levels um, closely throughout the course of the treatment. Okay? And that is it for this slide presentation. Thank you very much.